Hi guys, we have a case of a 50-year-old male with mid-abdominal pain. Let's get started. So let's just come from top. So there's pleural effusion on the right and maybe a really tiny one on the left. Here the pericardium and the heart looks okay. As I go down to the level of the liver, there is ascites like all around the liver, around the spleen as well, and I also see this hypodense lesion in the liver. Now, these hypodense lesions are always indeterminate if this was a young, healthy person and if this was all I was seeing with no history of malignancy. I may be tempted to just call this a probable hemangioma and not recommend any follow-up, but anytime someone is around 40, 50, then you have to think of could this be a metastasis. Colon cancer metastases are probably the common metastasis to the liver, and they tend to be hypodense as well. There's one right here as well. There's all these ascites. The liver does not look cirrhotic. Cirrhotic liver usually have a nodular contour. So now I'm starting to think, why does this person have so much ascites? And one thought that comes to my cancer is that could this be a malignancy as well? I'm looking at this peritoneal lining to see if I see any peritoneal nodularity or peritoneal deposits, because that would argue for cancer as well. I do not see that well, but one thing that catches my eye is that this omentum is way too thick. I have a different case pulled over here just to see how omentums should look. Let's slide it this way. So this is just a normal CT abdomen pelvis. See, when I scroll down, the fat in the mesentery and the omentum, it should just be nice and dark. I mean, some blood vessels here and there, but otherwise it should be pretty nice and dark. If we compare that to our current case, right here, you can immediately see that this is way too dense, and this is not from blood vessels. And you can imagine that, okay, is the ascites causing a little bit of inflammation? It could be, but this is way too thick. So the thought that comes to mind is that this is omentum nodularity from cancer metastasis, or whatever other disease can cause it, but cancer is the first thing that comes to my mind. Now there's ascites, there's omental nodularity. Now I'm really looking carefully at the peritoneal lining again to see if I see any deposits. And right around here, I do see some peritoneal deposits. Let's look at it in sagittal. It may be easy. So the bladder is compressed down here. This is all ascites, and there is some nodular deposits that is making me think cancer. So now the other part of the CT would be I would look at every organ carefully. I would look at the bones to see if I see any bony metastasis. And I'm unable to window and label this, but when I quickly scroll through this, I'm looking at the femur, superior pubic rami, pubic body. I'm coming to the ischium. Let's go on the other side. Nothing here. At the femur. Let's come down to the spine. I mean, nothing really jumps out at the spine. To quickly look at the ribs. Nothing in the ribs. No, nothing. Okay. So at this point, I'll just start my source pattern. So, and go through all the organs. So we found some liver lesions, ascites, omental nodularity, top differential is cancer. Let's just follow the colon real quick because colon cancer could be a culprit. I'm just following, I didn't see anything that really jumps out at me. I mean, here, is there some colonic wall thickening? Hard to tell. I am not convinced. Maybe someone who is more experienced, they could tell more confident if that's normal or abnormal, but that doesn't jump out to me. I mean, here too, is there some thickening here? I'm not so sure. I don't think I would call that. So nothing in the colon jumps out to me. The next best step for management of this patient is I'll probably just do a paracentesis and look for cancer cells in the ascites, and that probably would be the best way. If that does not give us an answer, then we could do a ultrasound or ultrasound guided liver biopsy, but for that we probably have to take the ascites out so that the abdominal wall is touching the liver. We could also do an ultrasound or a CT guided biopsy of the omentum. So those would be the three options to find out where the cancer is coming from. Probably just a paracentesis is the best first step. Let's see. So they said that they saw near obstructing colonic mass at 40 centimeter. So 40 centimeter probably 40 centimeter probably was this thing that we're talking about. Yeah, but at my level of training, I don't think I would confidently call this a mass. That's what this case is. Very typical case of peritoneal carcinomatosis. We saw those peritoneal deposits. We saw ascites. We saw the peritoneal nodularity. We did see the omental thickening, and we did see the hepatic metastasis. And in the absence of known primary tumor, ultrasound-guided biopsy of the omentum can be done to obtain a tissue diagnosis. Thank you for watching the video, guys.